I experienced the side effect of cancer, financial toxicity, 8 years before the term was even coined by Doctors Yusuf Zafar and Amy Abernethy at Duke University. I heard it, though. I heard all the challenges that women were facing in the treatment waiting room. So I had 6 weeks of daily radiation, Monday through Friday. And while there were some changes in the individuals who were waiting for the radiation treatment, we started chatting and talking, and they were all working women who had on unpaid leaves, and they were really worried about what was going to happen. So the conversations I heard were things like, we're probably going to have to pull our son home from college. I think I'm going to put the house on the market. I've maxed out my credit cards. And then I heard this. I think I'm going to have to stop treatment and go back to work because my treatment's going to outlast my FMLA benefit. And I'm going to lose my job, and we will lose everything. And so that's when I went to the social worker at the hospital and said, is there anything out there to help people? And she looked at me, because by that point I was in line at the food bank, and she handed me a $50 Kroger card, which was nice, but wasn't going to solve any of my problems. So I went home to my third time's a charm husband, who I call Tom Terrific, because you have to be terrific or insane to marry a twice divorced, middle-aged children with 5 children, night sweats, and a mildly demented mother. And I approached Tom and I said, I have this idea. I think we should start a charity to help pay some of these non-medical bills to improve treatment adherence and help these women kind of bridge this gap so they can go back to work. And of course, he thought I was crazy. And he told me later, he said, I know you lost your breast. In his head, he's like a thought bubble. I know she's lost her breast, but now she's lost her mind.
This is Genetics for Healthcare, a podcast for patients.
Today, I'm privileged to have the CEO and founder of the Pink Fund, Molly MacDonald. The Pink Fund provides financial assistance for up to 90 days for non-medical costs of living expenses for breast cancer patients who are in active treatment, who are currently in therapy, so they can focus on healing, raising their families, and returning to the workplace. It's an extremely valuable service to help patients and their families combat the financial toxicity that comes along with treatment for a chronic disease like cancer. Molly, thank you so much for joining us here on Genetics for Healthcare.
Thank you for having me.
When I learned about the Pink Fund, and some of the folks that I've had and interviewed on this podcast suggested I reach out to the Pink Fund, and then Eureka, I went to ASCO and connected with your representative who was at the American Society of Clinical Oncology. But I learned that you turned your personal battle into this public mission. You transformed from a patient to a patient advocate, raising awareness and creating some real solutions to address financial toxicity associated with cancer care. As you were going through your battle to conquer cancer, what was the specific moment when you thought, this is how I want to help?
So I was diagnosed with the earliest stage of breast cancer, which is, some people say it's not cancer, it's stage 0, where the cancer cells are hovering around your milk ducts and getting ready to break out and form a tumor. And so it was unlikely to take my life, but it took my livelihood. So I was transitioning between jobs. At the time, I had my annual screening, never thinking I'd have a problem or a callback, which I did. And then when the diagnosis came, I was going to be part of a woman-owned division of a business out of Kentucky, here in Detroit. They were going to open an office here. And I felt like ethically I couldn't let them make an investment in that and in me, because I didn't really know what I was facing. In retrospect, I probably could have slogged through it, but in any case, it left me unemployed and unemployable, because you really can't go get a job when you're saying, well, excuse me, I have to have some surgeries and some treatment, and I could maybe start, this was April, I could start maybe in September. So I don't have any income, and I have a COBRA premium for my health insurance of $1,300 a month. This is pre the Affordable Care Act, so there were no other resources for me. Wasn't eligible for Medicaid. I experienced the side effect of cancer, financial toxicity, 8 years before the term was even coined by Doctors Yusuf Zafar and Amy Abernethy at Duke University. I heard it, though. I heard all the challenges that women were facing in the treatment waiting room. So I had 6 weeks of daily radiation, Monday through Friday. And while there were some changes in the individuals who were waiting for the radiation treatment, we started chatting and talking, and they were all working women who had on unpaid leaves, and they were really worried about what was going to happen. So the conversations I heard were things like, we're probably going to have to pull our son home from college. I think I'm going to put the house on the market. I've maxed out my credit cards. And then I heard this. I think I'm going to have to stop treatment and go back to work because my treatment's going to outlast my FMLA benefit. And I'm going to lose my job and we will lose everything. And so that's when I went to the social worker at the hospital and said, is there anything out there to help people? And she looked at me because by that point I was in line at the food bank, and she handed me a $50 Kroger card, which was nice, but wasn't going to solve any of my problems. So I went home to my third time's a charm husband, who I call Tom Terrific, because you have to be terrific or insane to marry a twice divorced, middle-aged children with 5 children, night sweats, and a mildly demented mother. And I approached Tom and I said, I have this idea. I think we should start a charity to help pay some of these non-medical bills to improve treatment adherence and help these women kind of bridge this gap so they can go back to work. And of course, he thought I was crazy. And he told me later, he said, I know you lost your breast. In his head, he's like a thought bubble. I know she's lost her breast, but now she's lost her mind. But I always say, because he sleeps with me, and I was a lot cuter 20 years ago, he went along with it. So, he knew what was good for him. And so without him, there wouldn't be any Pink Fund, because I was the visionary and he was the guy who was sweeping up behind me. I'm leaving a trail of things that needed to be done and applications to the government and write bylaws and develop a board of directors. And none of those things were particularly interesting to me. I just wanted to go out and start this organization, raise money, and help people. Next year, we'll mark our 20th anniversary in this space. We were the first, actually, I think, to this space that dealt with this financial toxicity side effect. And now there are many more organizations that are picking up some of that slack, not only just for breast, but for other cancer patients in other disease states as well.
I want to get into the operations of your organization, which has grown pretty bit. So let's put a pin in that. Just some of the information on the experience of patients and families who are battling cancer care, whether it's breast cancer, lung cancer, colorectal, or any other chronic disease. On your website, you cite a study done at Dana-Farber. And I'm just going to read some of the statistics. They're not all of them, but 67% increase in financial difficulties for people without insurance. Again, you mentioned in your experience, women were on leave or short-term disability, but if you run your own business or self-employed, you may or may not have insurance or adequate insurance to cover your time away from work. 42% of people in this study experienced an increase in financial difficulties for Black and brown people, minorities in the United States. 37% of people in the study had to make at least one work or career modifying decision due to their diagnosis with cancer. You mentioned that you were addressing the problem long before there was an actual, title associated with it. But how do you find financial toxicity? Is it more than just finances?
So the medical costs, right? So that would be your insurance premium and your co-pays and your deductible. So that's one bucket. Then we have what we call the indirect costs. And those would be things that come along with particularly lost income, or you're paying for the medical bills and you can't pay your household bills. So those indirect costs of cancer, are some of like the household bills, but sometimes it's things like wigs or prosthetics, other medications that are not covered by insurance, other products, those kinds of things. So basically the way I describe financial toxicity, and it could be from cancer or any other thing that hits you, if you think of your life as a Jenga game, like a tower of blocks, and you receive this life-altering health diagnosis, in my case, cancer. And on those 3 blocks in the bottom, immediately the foundation of your life is rocked. And the block that gets pulled out is one on the right or the left. It's not in the middle. And while the tower is still standing, there's this sense that the sands have shifted underneath you and you're not stable. And then you find out that your employer provided insurance with that really high deductible because you took that out because you could afford the premium and you didn't anticipate getting a cancer diagnosis, is very significant. And it's November. And it's going to reset in January. So basically what starts to happen is more and more blocks are being pulled out of your life, things over which you have no control, and the pressure is building. So, when we play Jenga, we keep putting the blocks on top of this tower, waiting for it to collapse. So I describe what we do at Pink Fund is we are not fixing this. We are stabilizing you. We are putting scaffolding around your life for a brief period of time, and we call it a financial bridge, that hopefully allows you to complete your treatment as prescribed to avoid medically related bankruptcy and improve not only your financial health, but your mental and emotional health. So in my case, the thought that we were going to be homeless because my home fell into foreclosure, because I had to make a decision between paying my health insurance premium or my house payment. As I said earlier, I wasn't eligible for Medicaid and Pre-Affordable Care Act. I didn't have a change in circumstances that legislatively would have allowed me to change insurance plans. This financial toxicity is often described as a grade 4 side effect of cancer. So to give you an idea of what that is like, a grade 4 physical side effect of cancer might be unrelenting diarrhea, where you literally can't leave home and you're paralyzed. And financial toxicity can paralyze you mentally and emotionally and physically. It's a huge, significant side effect. More and more studies are being done. It definitely affects more people that are underserved in our communities. It can affect people in urban areas and rural areas and frontier towns where they might have to drive 4 to 6 hours to get treatment. So then that's another indirect cost, is gas and parking, and all these things add up that sometimes make your situation just intolerable and result in impossible choices.
You did a beautiful job of really helping illustrate and paint the picture of the ripples that happens when someone gets a cancer diagnosis. And you mentioned studies. I came across this study just this year that was led by the American Cancer Society, and it was looking at the trust that patients had with their care providers. Obviously, they trust their doctors, they trust the scientists. But this study, and I'm just kind of not directly quoting it, just paraphrasing here, but the unmet social needs of adults in the United States were associated with a substantial reduction in the trust of cancer information from doctors in the healthcare system. And unmet social needs, and we're talking insecure food, housing, transportation, access, the things that we just can't possibly grasp unless you've been in that situation firsthand or with a loved one. Those unmet needs were associated in reduced trust. And here's the data points from this study. 39% lower for respondents with one unmet need, 51% lower trust in what their doctors are saying to them when there are two unmet needs like housing, food, transportation. From your experience, how does this stress and anxiety, because financial toxicity, as you just painted the picture, doesn't exist in a vacuum, but how does the stress and the anxiety affect a cancer patient's mental health and ability to focus on getting well? And not just them, the people around them, their family members.
Yeah, well, in my case, I'd been through this financially devastating divorce. I had all my 5 children with my second husband, who ended up filing bankruptcy. I had taken out a life insurance policy on myself when I left my marriage, knowing that, what if I passed away before all my kids were 18 or able to care for themselves? I think the policy was only at $500,000 because it was all I could afford. And I remember thinking that, maybe my kids would be better off and not homeless. This was after my house fell into foreclosure if I wasn't here. And I had started thinking about how could I take myself out and make it look like an accident. Like, not that I purposely died of a self-inflicted wound or suicide. I didn't own any weapons, so that wasn't even a possibility. No matter what I did, it would leave my children devastated. And I just had to plow through that and find a way out. Fortunately, in my case, and unlikely for most people, is my mother was able to help us so that we did not lose our home. And then I was able, once I finished treatment, to get a job and resume payments on the property. But many people tell us in their notes of gratitude that they can't sleep at night. And, we know all of that. Lack of sleep causes inflammation, and inflammation causes disease, and disease is fed by all these chronic stressors. So we know anecdotally that the mental and emotional health of the individual patient is improved when they don't have to worry about these bills for 90 days, and that of their family as well. Often we actually received a donation from a gentleman whose wife we had helped. We had helped her, and she passed away, and he had his own life insurance policy. And so he named us as the beneficiaries because he was so grateful for what we've been able to do for her. But I want to go back to screening for financial toxicity. And I know you didn't ask me this, but here's the problem. They didn't really start screening for financial toxicity until a couple of years ago. and they don't do it consistently. And there is also a lot of bias. So if you look, I'm just looking at me today. If I walked in and the way I'm speaking and the way I appear physically, nobody would look at me and say, in 3 months after this lady gets her diagnosis, her house is going to be in foreclosure because she won't have a job and she won't be able to make the payments. Nobody's going to know that at the end of my treatment, when everybody stopped delivering, food, which was lasagna practically every night, that I'd be in line at a food bank to feed my family. Nobody asked me any questions. Did I have any concerns about being able to pay for my treatment or losing my job? So now that is changing. And we recently did a study with Dr. Lila Garzai at Northwestern University in Chicago. It was published 2 years ago. And what came out is that patients want to be screened, and they want to be screened at the time of diagnosis and along the care continuum. Now, how they want to be screened is very different. Some of them want to talk to a physician. Some of them want to talk to a financial counselor. Some of them want to talk to a social worker. Some want to do it online. Some want to do it in person, on the phone. And so until we start to really screen, we are not going to know what these social determinants of health are, the challenges that patients have. Now, the other side of that sort of screening coin is many patients are fearful that if they express concern about being able to pay, that they're not going to get the best treatment. And we know that anecdotally as well from patients who have said to us, well, if I told my doctor that I can have my double mastectomy, but I can't start chemo because I can't afford to not go to work. And his response was, well, we'll give you a lower dose. In that patient's mind, it meant my survivorship is going to be compromised. I may have a job and I may be able to get my treatment, but my survivorship is compromised. So until we start screening and then sitting down with a patient and a financial navigator, because again, this is also a holistic problem. When the patient can't pay for the medical care, or they don't show up for the chemo infusion or the radiation treatment, there are room costs, staff costs, equipment costs, all these things that roll into what the cost of your care is, that is not being covered because that patient didn't show, and that patient is not going to call you up and say, I can't afford to get here. I don't have a car, or I can't pay the parking fee at the garage. So it's a holistic problem, and I think it needs to be addressed in such a way that it not only mitigates the challenges for the patients, but also can help to improve the bottom line for the hospitals in the provider setting, where they're not sending all these bills to collections. And then, those get paid, 5 cents, 10 cents on the dollar, plus they have to pay the attorneys. I mean, it's crazy.
Yeah, I got to park right there because in the world of clinical genetics and genomics, ordering, these tests to identify if a patient has genetic or genomic aberrations that might qualify them for a clinical trial or targeted therapies. Early on in this phase, and there's plenty of studies out there that show that patients just aren't getting testing. Patients aren't getting testing that unlocks access to these new therapies and things. But one of the things, as I was leading commercial teams and they would go in and talk to providers, the providers were concerned about the cost of these tests. And now it's a legitimate concern, but the reality was, in practice, their concern about cost meant that they wouldn't introduce that as an option to patients. Secondly, that's one thing that I would just really get on my soapbox and really get pissed off, because this test is, your insurance might pay $1,000 for the test. And I'm not saying that's not trivial. That's a lot of money. The services that you're providing, from your office visit to hospital stays and all these things, are tens of multiples of thousands more. That lab test that could help that patient to get genetic and genomic insights, these companies are not sending these patients to collections. It's your hospital system that's sending these patients to collections.
Right.
It's the adherence issue around financial toxicity, both from the patient side making decisions, but also from the provider side. And your solution of really understanding how to screen for this, I think, is pretty important, both financially and both, clinically.
Well, until our hospitals and our medical centers understand that, really feel it's a holistic problem, and it's going to improve not only their outcomes, but patient outcomes by having financial counselors trained, certified. And by the way, there's no certification for financial counseling in oncology that I'm aware of. But if there was a standard for it, and every hospital had to have staff, I mean, you could even have possibly contractors who come in and perform this work, I think you're going to see better outcomes for everybody.
The good thing is you were able to lean on your background as a journalist to start this organization. Tell us about the first steps you took to create the Pink Fund, and specifically, help with medical expenses. I think we understand why that was a focus, but how'd you kind of get there?
I just believed that I could do this. I mean, I really had no experience running a nonprofit. I'd done some volunteer work in the past. I didn't understand any of the legalities of it or things that we had to do. I bought a book called How to Form a Nonprofit Corporation. It came with a DVD, and it was about this thick. And I handed it to my husband. I said, "Read this and tell me what to do," because I'm not going to read that book. But I had this vision, and I had a passion for helping people, which, by the way, I wasn't like a Mr. Rogers type in the past where I really looked for people I could help. I mean, I don't think that was part of my thing. But because I had this experience and I met other working women who were having the similar challenges, I just became empowered to change it. Henry Ford, whether you like him or not, he has a quote that I really love, and he says, "Whether you think you can or you can't, you're right." And there is so much science about what we put in our minds, right? What we allow, the messages that we send ourselves. And so the first step was I had a failed attempt with another organization that I started with my surgeon and my girlfriend the previous year before I launched Pink Fund. And that was a fairly shocking thing. My surgeon and my girlfriend decided that they wanted to take over my organization and leave me out. And so I later came to realize I think that was maybe ego on part of my surgeon, but I'm not sure. She was a great surgeon. But I decided, no, this is a good idea. I'm going to do it my way. We're going to start over. I also had a vision for a national organization right out of the gate, knowing that, clearly this problem wasn't just relegated to the state of Michigan. So I had a big goal and a big vision, together with my husband. We launched this. So what I did was I started going out and I did speaking engagements. I think here I have this. I had this bust. I don't have a picture of my bust.
Gosh.
Yeah. Look at this. I put this on the back of an ADT sign. And I don't even know where I got this sign because I didn't have protection at my house. I keep wondering, did I steal that or somebody? I don't think I did. But anyway, so I did these. We had a plaster cast of my bust, which I don't have a picture of. I don't think. I should have had that. But my husband cast up my bust pre-surgery in 32 pounds of dental stone. We put a lucite rod in it. It was painted beautifully. And I went out and I did these bus stop speaking engagements. And I just talked about what had happened to me. So I'd go to churches and synagogues and men's groups and women's groups. And I was out doing that for years and years and years, raising money and raising awareness that this was a problem. And then I called the medical writer at the Detroit Free Press, where I'd once been an executive. And I shared what I was trying to accomplish with her when I moved this over to Pink Fund from the other organization. Asked her if she'd write a story, and she agreed to write a front page story, which launched us on October 2nd, 2006 in the Free Press, which at the time was part of McClatchy newspapers and was picked up by 27 newspapers. So that kind of launched us. We got a donated website. I traded a kitchen table. I literally traded my kitchen table to the graphic designer for our heart and ribbon logo and design elements. So we just kind of bootstrapped the whole thing together. And then in 2007, I put Ford Motor Company on my vision board, knowing that they were very big players in the space, working solely with Susan G. Komen at the time. And in 2012, I was invited to pitch our value proposition to Ford, and they picked us up and took us national.
5 years later. See, that whole clip is, we're going to distribute that for entrepreneurs, those who have a dream, those who have a burning desire to do something. I mean, it just speaks so much to me in terms of, where you're going to be. You have to keep the end goal in mind, right? And no matter what it looks like today.
Yeah, I have a vision board and I add to it. So back in 2007, when I first made this vision board and put that Ford blue oval on it, I also put what is now Rocket Mortgage Quicken Loans on it. I have secured a meeting with the chief marketing officer of Rocket in November. This is very premature, but I really think they'd make a perfect partner for us in the housing area. They fully understand what happens when people can't pay their mortgage for various circumstances. And in fact, in Detroit, there's a whole section from Rocket on the philanthropic area to help people stay in their homes when maybe they have unpaid taxes and help them negotiate so that they don't lose their homes. So I'm hoping that will happen. I put CVS Health on my vision board in 2022. And last year they picked us up did in-store advertising in all their pharmacies, specialty pharmacies, which I think there were about 9,000 last year, every hour on the hour for 3 weeks, in-store radio advertising for Pink Fund. And what that did for us is it enhanced our brand equity, as does the partnership with Ford. The messaging was a give help, get help messaging. So we started seeing some applications come in from other parts of the country where they'd never come in from before. And we're assuming, because we can't track it, we can't track it digitally, that was a result of that program. And CVS is doing that again this year, 4 weeks in October. We also have another fabulous national partnership with Snap-on Tools. We're in the 10th year of that partnership, where their franchisees share that we're a resource to their customers and in their communities. And that kind of aligns with Snap-on getting your car repaired, having transportation to get to treatment. Our other really significant one is Fleet Farm, which is 49 General Farm stores in 5 rural states. And they did charity checkout for us. This will be the 4th year of the partnership. And it's been really remarkable to see how they help us reach people that we could not normally ever reach. So any of these partnerships that we have, they have to be a win-win. They have to be good for our retail or for-profit partner as well as good for us. So
it's an amazing point of validation along the journey of building your nonprofit to get the validation for getting a Ford Motor Company and moving forward. Let's make that practical for those who are listening. What did that mean in terms of the scale of what the Pink Fund can do? Because I've heard you talk about the actual number of bills and families that you've been able to help.
When Ford, as I said, their other partner was Komen, who at the time was primarily devoted to research and also providing resources in various communities where they had chapters and affiliates. And so what we were doing wasn't in competition with them at all. So Ford launched a national ad campaign for us called Time to Fight. And they placed full run of press, full page, full color ads in People in Style, Ladies Home Journal, Us Magazine, People, Us, Ladies Home Journal, and also did TV spots. So I brought in a celebrity partner, James Denton, who had played Mike the Plumber on Desperate Housewives. Really too long a story to explain, but I'd met his wife, and then she found out what I did. And her sister had been diagnosed with breast cancer. And then his mom had died from breast cancer because she was a working widow at the time. She felt a lump and couldn't afford to not work, and so didn't get treatment and passed away. So we had an actual story, that resonated, a real story. And then we had, this man wearing these Time to Fight t-shirts that Ford manufactured 6,000 of them. So what happened was our revenue and our ability to help people jumped from about 68,000 we were paying out in 2012. I wasn't paid yet, to 212,000 we paid out the next year, and then it just kept jumping. So this last fiscal year, we paid out 1.5 million in bills. So we're at about 10 million now total.
I keep saying I wish I had an applause track because I'd push it right then. Someone to get me an applause track. It might.
Well, I do want to say something you mentioned about entrepreneurs. So when I make these vision boards, so Oprah's never called me. I put her on there in 2007. She hasn't called me yet. So I always say not yet.
Me too. Absolutely.
Right?
Come on.
But not yet. And
Yeah.
I've had some that haven't worked out the way I wanted them to, but they've worked out in one fashion or another.
For donors or corporate sponsors who might be even listening to this right now, someone who works for them, why is supporting the Pink Fund not just charity, but a critical investment in the health and stability of communities?
Well, we watch what happens when people fall ill and don't get treatment and end up in the ER, right? Costing them time and money. And often the outcomes aren't as strong. The other part of financial toxicity you can end up homeless. This lady that we helped a few years ago, she lives in a trailer, and we paid her lot rent. And she said, if I had not gotten help from you, I would have had to add homelessness to my list of things to manage. And so we know what happens when people are homeless. They commit crimes, they get sick, they're at risk for being murdered. I mean, it's terrible. So I'm not going to go to the extent that we're saving people from all those horrible things that could happen, but we are, as I said, reducing those burdens.
I would say that it does go to that extreme because, as you've seen, like the different circumstances that some people will consider a minor inconvenience to utter devastation and life-threatening conditions other than their disease. Your timeliness and those resources are vital for people in these communities. One of the things that you've done, you mentioned that you started this effort, and now you have an annual gala that happens every October called Dancing for the Survivors.
Mm-hmm.
Tell us about that, and what is your mission this year?
Dancing with the Stars was a really popular show, and for a while, my daughter in LA was a stylist for one of the pros on that show, and so I had this idea of taking breast cancer survivors and letting them take dance lessons. They take them from Fred Astaire Dance Studios that donates the lessons, actually here in West Bloomfield, Michigan, allowing them to perform to music and some style of dance that resonates with them and choose their dance partner. And the first step I knew is that dancing is very healing. It's very good for your immune system and your mental health. But I knew that it would combine education and entertainment with inspiration. So this event, we have somewhere between 3 to 5 dancers, and they tell their sort of backstory of their diagnosis and what things were like for them and if they experienced financial toxicity in video. And then they perform in front of a crowd. I think last year we had 440 people there. It is our only single major fundraiser that we Pink Fund put on. All the other money that we raise comes from corporate partners, individual donors, and grants. So we have a diverse portfolio of donations. So while our gala is important, it's just here in Michigan. So since we're a national organization, we cannot be hosting galas all over the country. It's just not tenable. The other thing you asked about was why would a corporation or a partner want to work with us? Well, Stanford Social Innovation wrote about Pink Fund a few years ago and said that it rated us as one of the top breast cancer charities because of what we do and our why and the responses we get. We can give you data. So for example, Ford Philanthropy recently asked us can you give us a list of all the car payments you made and to what creditors in what states? And we can do that. So we track all this data so that our donors know, who we've donated to. In fact, we had a meeting with Ally Financial last week. One of their directors, Jack Howard, is going to be our financial wellness columnist for Breast Cancer Wellness Magazine, which we acquired last December. And I can tell you a little more about that. But again, having those strong corporate partnerships like names like Ford and Ally and Snap-on and Fleet Farm and CVS, those things all lend credibility to other potential donors. But I will say again, like I said before, the most important thing working with a corporation is trying to find the win-win. I mean, sometimes they just want to give you the money because they want to be in the breast space and that's the end of it. But sometimes there's a great natural alignment that allows them to really take that to market and show that they're good community partners.
Here on Genetics for Healthcare, and by the way, for those of you who are on a listening platform like Spotify or Apple Podcasts, we do have a video platform. So the bus stop is hilarious that you can go back and look at this on our website and on YouTube, by the way. We also want to post links. Well, obviously post links to your website and the resources that we've talked about in this conversation. I do want to get the link to the financial toxicity screening study that you did with Northwestern. But we like to ask guests, for those who are watching, because somebody has been impacted by breast cancer or a cancer diagnosis, and they may be facing this kind of financial toxicity that we've talked about or know someone who is. So we like to ask our guests to share 3 practical tips with our audience that could help them navigate this incredibly challenging aspect of a healthcare diagnosis. So what are 3 things that you would advise? Obviously, we're going to send them to your website and all the great resources that you have. But what would you suggest?
Well, I think the first step, if you're open to it, is to talk to the social worker, because the social worker where you're being treated may have resources that we're unaware of as a national organization, in addition to what he or she may provide you. So that's number one. The second thing, even before you get to that point, if you're diagnosed with cancer, I think you need to really understand what your insurance covers or doesn't. It may be that you can switch carriers, and it may be that some drug, which they call a formulary, that you have to take is not covered by your insurance. So that's a change in circumstances that you could switch insurance companies. So understanding your insurance, really getting a good handle on what your basic household bills are, what you are putting out every month. Most people don't really do a budget. I do a budget every year, annually. I look at, everything and figure out what I can cut or not cut. Like one of the crazy things is if I cut my hair every 6 weeks instead of every 4 weeks, I save $150 a year, and I can spend that $150 on a new pair of shoes or something. I mean, it's just kind of, I guess they call that girl math, but so understanding your health insurance, understanding your household budget, also determining, are you going to tell your employer if you're employed? Because that can not always go so well. So there's a great organization called Cancer and Careers, and they have a lot of great information for patients on how to handle those things. Often they'll tell you to go to HR because you may be eligible for the FMLA benefit, which to my understanding is the company must have 50 or more employees within a certain radius of one location to be required to provide an unpaid medical leave. But you need to know what your employee handbook says about leaves, whether they're paid or unpaid, how long you can take and maintain your job. Can you come back and get a job at the same salary? So going back again, what your insurance covers, what are your household bills? If you're employed, understand your employee handbook and your benefits or lack of benefits with that employer. And then once you put all that together, but the problem is you get this cancer diagnosis and you're flooded. You often are kind of paralyzed mentally. So it's a good thing to maybe ask a trusted friend to help you. And often the patient is reticent to share how concerned they are, as I mentioned earlier. So taking a good advocate, I call them like a kick-ass, take no prisoners advocate who's going to speak up for you, because then if the doctor or someone else is pissed off at the question, they're not pissed off at the patient. The patient's always worried that they're going to piss off their doctor by calling them into doubt by asking a question, right? We don't know everything. And the medical system is full of acronyms and things I don't understand. I'm a person who raises my hand and says, I don't know what the hell you're talking about, but a lot of people are afraid to do that. So having an advocate is great. And that could be a family member, or even better yet, somebody who's been through this. So there's two great organizations. One is Immerman Angels. They'll match you with another survivor of your same disease. They'll try to get you as close racially, ethnically, age, income, education, so that you really, and I don't even want to call it window dressing, but all those things that could get in the way of you being able to communicate are so similar that you feel safe with that person. It's kind of that nobody knows the trouble I've seen, until you meet somebody else who's had that same trouble. So yes. I think that's important. So Immerman Angels is one, and the other one is after breast cancer diagnosis. It's called ABCD, and they're out of Wisconsin, but they'll match you with a breast cancer survivor who's not afraid of what you're going to tell them or say, and can help you provide other resources as well.
Tremendous practical tips for our listeners. Hey, don't worry. I'm a girl dad, so I understand girl math. So Molly MacDonald, founder and CEO of the Pink Fund. Go check them out on their website, and we'll have those links if you're listening to this on Spotify, YouTube, or on our website, geneticsforhealthcare.com. You can see those links, click them, and check them out, and refer them, pass them along to someone who might be able to benefit. Molly, thank you so much for your time and just the wealth of information about this very important topic that we just don't hear enough about.
So can I add in one more thing?
By all means.
So I mentioned Breast Cancer Wellness Magazine. It's quarterly. It's free to subscribe. When you go to our website, pinkfund.org, you'll see subscribe. Recent issue just dropped yesterday. So a lot of the information is what we call evergreen. So it's going to help you no matter where you are. And we have a diverse cohort of highly credentialed content contributors too. So it covers everything from early diagnosis, dense breast, genetic testing, diet, exercise, sex, insurance. I'm trying to think what else is in there. And then we have a special section every publication. This month, it's metastatic this month. And then there's always a cover story. In the December issue, which come out, it's young survivors, and next fall it will be next spring will be body image. So, but it's free, so you should get it.
Excellent stuff. We'll also have that link on our website and the pages, and we'll clip that so we can be earlier in this conversation to make sure that people are able to access that. Thank you so much for being a guest on Genetics for Healthcare.
Thank you for having me.
This is Genetics for Healthcare, a podcast for patients.